My name's Deb. I have hypermobility Ehlers-Danlos syndrome. I also have a 10 millimeter pineal gland cyst. It's right in the middle of my brain. And I'm never really sure if it's the cyst or my Ehlers-Danlos that makes me sick. I just recently joined the pineal gland cyst group here, as you can see. It's called Pineal Gland Cysts and Tumors, a public group. Here, I finally got the guts up to post a question. I shall read so you don't have to. Okay, this may sound crazy, but so many of you have comorbidities of Ehlers-Danlos. And the odds of having both conditions would be like winning the lottery. Please tell me your pinky fingers do not bend up 90 degrees. Diagram to follow. I expected to see a whole bunch of no's, maybe a yes here or there. Let's see what happened. As I continue, I assume my cyst symptoms get bad in low-pressure weather fronts because it's basically just like a little balloon that gets bigger in low pressure. But I am hypermobile. My connective tissue is quote-unquote faulty. It makes sense for me to experience my pineal cyst differently than all of you because of my other genetic condition called Ehlers-Danlos syndrome. So please just tell me yes or no below. And they did that, okay? And then I got a whole bunch of yeses. Okay, so there's the drawing I sent them. And Michaela, my fingers do not do this. I'm like, hooray, we got a no. And then we got a, yeah, it does. Never thought about it till now. And she goes on into a total discussion with me where I have to guide her through the basic positions of Ehlers-Danlos and the comorbidities. So that's just one thread with one person. Okay? And they're coming in rapid fire, wanting to know what the hell is going on. Lori here. Hers does. Christy. She's a yes. Nikki Hill? Yep. Rachel even knows she has heads. Tanya here doesn't think they're related. However, she's hypermobile too. And a 2 centimeter cyst. Twice my size. She doesn't think they're related. I think she needs to come back and look again. Alicia. Most of my fingers do. That's weird. What does that mean? My daughter has pineal cyst. Both me and my kids have heads. Natalie. According to a geneticist she saw, they couldn't really figure out if she had EDS or Marfan's. And she has comorbidities of Ehlers-Danlos. So she's obviously a yes, and I'll show you why. Well, there's her fingers down there. So even though she was, not diagnosed officially with it, those are her fingers. Here's another one. Tina. She's got hypermobility everywhere. Nellie Lee. My fingers do bend up. But so do a lot of normal people, I've asked. Not sure if that's enough to diagnose EDS. I said, Nellie, no, of course it's not. Gave her some instructions. Gray Jones, yep, EDS confirmed. Charity Monroe Lynn, okay, so my husband has the pineal cyst, but you sparked my brain because I have overly flexible joints and bruise super easy. I don't think she counts if she doesn't have the cyst. But it's kind of a weird coincidence, and kind of shows the commonality of hypermobility. Kathy says my daughter has every symptom of heads. Sees a rheumatologist. Yep. She had her pineal cyst removed in 2018. So all of her remaining symptoms are from heads. Carol, finally. Mine don't, in fact. None of my fingers do. So now what? I'm so confused. Just wait. Carol Ray? I said, Carol Ray, you're wonderful. Don't be confused. You don't have to be flexible to have a cyst. Thank you so much for answering no. And she returns here. Uh-oh, Deb, I posted wrong. My fingers do this. They always have. I thought I was just double jointed. I misread the post. I thought they should stay straight. Carol Ray's got it too. Mikkel Wells. Well, it's reasonable to assume that our collagen is faulty, therefore it can stretch and allow cysts to form. I have EDS classical with vascular features. And she goes on, we can do a little discussion about what the fuck do we do now with this information. And we start spitting out information to understand what EDS is, because this yes list has gone off the frickin' rails. Carly, yes, might do that. I always thought it was odd. And we got to do a nice long discussion there. And some more information, this time on tethered cord. I don't know why she wants to add that in there, but okay. And Robin, yep. Me and my girls. Little girl's got a cyst. We all got EDS. Sonia, she's just a plain old yes. Jennifer Clark, my 3-year-old's in the process of being diagnosed with EDS. And she also has pain. Tam Brown. Mine do as well. Teresa. I can do that, but I don't have hypermobility. And then they get into a big hish-hash saying that it's not flexibility, Teresa. It's hypermobility, which just means something a lot less different than what you're thinking. And then she finally understands that, yeah, she might have it too. People calling other people into this bomb I threw in here. Genevieve, yes, I have it. Larry, I did lift my finger up. Would it pop? No, it hurts like hell. Not sure about him. And Cassie, hey, she just got diagnosed with EDS. Isn't that just great? Rachel, I have what Dr. Kim's nurse actually said a large amount of their patients also have EDS. Okay, and they're talking about pineal cyst doctors. My EDS actually resulted in me developing an AVM. I used to know what that means. After the cyst removal. He had never seen this happen before, but I'm sure it's from my EDS. Amanda Phillips. Ha! What the? Talk about weird. My doctor's currently testing me for EDS. My dad's also hypermobile. I'm hypermobile. He started having issues with his hips, shoulders, knees, and uterine, gastro, osteo, bruise easily. Yipper. Saline Smith's asking, well, how the heck do we test for EDS? Now, why does Saline care? Did she answer yes earlier? Can we count that as a yes? Laura, pretty sure I got it too. I roll more joints than a pothead every single day. I'm going to talk to my roomie. Yvonne. Talking about her discs in her spine, degenerating, stenosis. Physical therapist said I was hypermobile. I'll call that a yes. Please do this because me and Baron have hypermobility as well. Donna, that's a double yes for Donna and her family member. Sandy, not me. There's a no. I'm a little less flexible than the average person. Good for Sandy. Was that our second no? Third no? Better start keeping track. Yes, I have EDS, Isla states. And Lori, we saw earlier, she was a yes, and she's just trying to calm everybody down. This is, as you see the timing at the bottom, it says, this is 1 day. 1 day versus yeses and nos for, are you hypermobile? All of you people with pineal gland cysts, are you hypermobile? And I went back up and I edited my original post as I was shaking. I was freaking out. And I wrote, edit. I suspected this for years. Holy moly, way too many yeses. Everyone who answered yes. It's now time. I'm like, calm down. Just get your Biden score. Then you need to not run to the doctor. You need to spend a few months figuring out if you do indeed have it. You must photograph all your basic positions, look up and learn about comorbidities, list the ones you think you have. Do not run to the doctor with a huge pile of proof. Spend a bunch of time in Facebook EDS groups to be really sure. This is a massive discovery, you guys, okay? Let's take a deep breath. I need every one of you who have symptoms of Ehlers-Danlos to know there's low-dose naltrexone. Okay, we'll pass by that part. Read, Google. And then I posted them to some of my newbie videos going through the 2017 criteria symptoms. And then after that, I guide them, of course, to our wonderful Ehlers-Danlos.com. Somebody needs to go back and keep track of this. Count the yeses and the nos. Let's see, where is this post posted? Well, it's in Pineal gland, cysts and tumors. Tuesday. Today's Thursday, May 16th, 14th. So this is May 14th, 2019 at 11:23 a.m. is when I posted this question. And I'm getting, what? Is this, are we up to 90% yeses? Somebody needs to know about this over in EDS land. Because some of these people in here, they know this already. They know that there's another pineal cyst group that's a private group. And they talk about Ehlers-Danlos, and they all know that they have it. Why didn't anybody tell the EDS people? Pineal gland cysts are obviously a comorbidity of Ehlers-Danlos syndrome. Come on, guys. We'll check back in on that post. I hope they don't take it down. I'm just grabbing this video in case somebody takes it down. This is big.